Today we are discussing about the topic platelets. Last class we discussed about WBC and today we are going to discuss about platelets. Platelets are also known as thrombocytes and these are cell fragments involved in human clotting system. The main function of platelets is to help in blood clotting and other functions are release important clotting chemicals, temporarily patch damaged blood vessels, and actively contract tissues after clot formation. And platelets circulate for 9 to 12 days in blood and it is removed by spleen. Like RBC, platelets are also removed by spleen. But RBC takes 120 days, but platelets take about 9 to 12 days. And one third are reserved in spleen for emergencies. Platelet also contain a central granule containing different chemicals and the chemicals are serotonin, calcium, enzymes, ADP and platelet derived growth factors. These chemicals helps in the clotting mechanism, helps in the formation of platelet blood formation. Next, coming to the normal value of platelets, the normal value of platelet is 150,000 to 500,000 per microliter. And based on the normal value, there are two types of condition that is thrombocytopenia and thrombocytosis. Thrombocytopenia means there will be abnormally low platelet count than the normal value. And thrombocytosis means there will be higher amount of platelets than the normal value. So these conditions are known as thrombocytopenia and thrombocytosis. And thrombocytopoiesis. We have studied about hematopoiesis. Hematopoiesis means formation of blood and erythropoiesis means formation of RBC. Thrombopoiesis means platelets. Platelets is also known as thrombocytes, isn't it? So thrombocytopoiesis means formation of platelets. Like RBC and WBC, platelets come from myeloid stem cell. In hematopoiesis, you have studied about myeloid stem cells and lymphoid stem cells. And from myeloid stem cells, platelets are derived. Differentiate into giant cells called megakaryocytes, which break off membrane-bound packets of cytoplasm to form platelets. That is, compared to RBC and WBC, platelets are not an entire cell. It is only a fragments. Fragments are produced from megakaryocytes. And it is controlled by a hormone known as thrombopoietin. Erythropoiesis is controlled by one hormone known as erythropoietin. Likewise, platelet thrombopoiesis is controlled by a hormone known as thrombopoietin. Next is hemostasis, the main action of platelets. And hemostasis means cessation of blood. He means blood and stasis means stop bleeding. That is hemostasis. And it consists of three phases: vascular phase, platelet phase and coagulation phase. And coming to vascular phase, vascular means blood vessels. So coming to vascular phase, it is when there is an injury in blood vessels, vascular spasm occurs. Vascular spasm means contraction of blood vessels and this limit the blood loss. That is the vascular phase and it is an immediate reaction and continues about 30 minute contraction. Next is platelet phase. Platelet phase consists of three steps. First one is platelet adhesion, second one is platelet release reaction and third one is platelet aggregation. So what is platelet adhesion? That is sticking of blood platelets into the injured site. Sticking, it is known as adhesion. Sticking of platelets into the injured site is known as platelet adhesion. When there is an injury, blood vessels are damaged, then collagens are exposed and platelets come in contact with the collagen and stick to the injured site. This is known as platelet adhesion. And next step is platelet release reaction. What is that? Once the platelet gets attached to the injury site, the platelet release its contents. Before I have told there are so many contents, so many chemicals in the platelets. Those chemicals are released. That is known as platelet release reaction. And these chemicals attract more and more platelets towards the injured site and thus form a big mass, big gel mass, and that mass is known as platelet plug. And this aggregation of platelet is known as platelet aggregation. So there are three steps for platelet phase. First one is platelet adhesion, sticking of platelets to the injured site. Second one is platelet release reaction, that is platelet release its contents to attract more and more platelets. And third one is platelet plug formation or platelet aggregation. More and more platelets come to the injured site and form a seal, and that seal is known as platelet plug formation. Next is coagulation phase. In coagulation phase, it is also known as blood clotting phase. It involves a series of steps that convert circulating fibrinogen into insoluble fibrin threads and turns liquid blood into a gel. What is the consistency of a blood? It is liquid, but after formation of clot, it is converted to gel. And blood clot is a fibrin network. It covers platelet plug and cements it. It traps blood cells and seals of that area and prevent blood loss. So, for blood clotting, there are some clotting factors that helps in blood clotting. There are 11 major proteins and 1 calcium ions, totally 12 factors. 11 major proteins and 1 calcium ions, totally 12 proteins, 12 factors. Coagulation pathway, there are two main pathway. First one is extrinsic pathway and intrinsic pathway. What is extrinsic pathway? If the blood vessel is injured if the injury occurs outside the blood vessel, it is known as extrinsic pathway. If injury occurs inside the blood vessel, it is known as intrinsic pathway. And what is common pathway? Extrinsic pathway and intrinsic pathway leads to a formation of an enzyme known as prothrombinase. And this prothrombinase helps in the formation of fibrin threads. That pathway is known as common pathway. So coming to the extrinsic pathway and intrinsic pathway, the difference between extrinsic pathway and intrinsic pathway is that extrinsic pathway involves only 1 or 2 clotting factors and it is a simple process, while intrinsic pathway includes 3 to 4 clotting factors and it is much more complex than extrinsic pathway. So coming to intrinsic pathway, as I said earlier, what is intrinsic pathway? It is an injury inside the blood vessels. When blood vessel inside is injured, collagen is exposed and the clotting factors, mainly the clotting factor 12 combines with collagen. Once it is combined with collagen, the clotting factor, inactive clotting factor 12 is converted to active clotting factor 12. And active clotting factor 12 convert inactive clotting factor 11 to active clotting factor. Active clotting factor 11 convert inactive clotting factor 9 to active clotting factor 9. Active clotting factor 9, and by the meantime thrombin also convert inactive clotting factor 8 to active clotting factor 8. And active clotting factor 8 and active clotting factor 9 convert inactive clotting factor 10 to active clotting factor 10. 10 clotting factor 10, clotting factor 5 and phospholipids together they form an enzyme known as prothrombinase. This is intrinsic pathway. Clear? So what is intrinsic pathway? If the inside of the blood vessels is injured, collagen is exposed. Blood comes in contact with the collagen and first which clotting factor is activated? Factor 12. Inactive clotting factor 12 is converted to active clotting factor 12. Active clotting factor 12 convert inactive clotting factor 11 to active clotting factor 11. Active clotting factor 11 convert inactive clotting factor 9 to active clotting factor 9. By the meantime, thrombin convert inactive clotting factor 8 to active clotting factor 8. Factor 8 and factor 9 convert inactive clotting factor 10 to active clotting factor 10. Active clotting factor 10, clotting factor 5 and phospholipids together form an enzyme known as prothrombinase. This is intrinsic pathway. And coming to extrinsic pathway, extrinsic pathway occurs when the blood vessels are damaged outside the blood vessels. Outside the blood vessels, it is the tissues. When it is damaged, tissue factor is released. tissue factor combines with factor 7 and convert inactive factor 7 to active factor 7. Active factor 7 convert inactive factor 10 to active factor 10. Then the process is same. Active factor 10, active factor 5 and phospholipids together form enzyme prothrombinase. So this is the intrinsic pathway and extrinsic pathway. Then comes the common pathway. In common pathway, what is formed? Which enzyme is formed? Prothrombinase. It is also known as prothrombin activator. Prothrombinase convert clotting factor prothrombin to clotting factor prothrombin to thrombin. Thrombin convert soluble fibrinogen to insoluble fibrin threads. By the meantime, thrombin also convert inactive clotting factor 13 to active clotting factor 13. This active clotting factor stabilizes the formed fibrin threads. So this is the clotting mechanism. Once again, what is the common pathway? What is the process in common pathway? An enzyme is formed from the extrinsic pathway and intrinsic pathway, that is prothrombinase. This prothrombinase convert prothrombin to thrombin. Thrombin convert soluble fibrinogen to insoluble fibrin threads, and these fibrin threads are stabilized by active factor 13. How is active factor 13 formed? Thrombin convert inactive factor 13 to active factor 13 and a blood clot is formed. So this is the mechanism of blood clotting. So hemostasis include three processes. First one is vascular phase, that is blood constriction. Second phase is platelet phase, that is platelet plug formation. And third phase is blood clotting by intrinsic pathway and extrinsic pathway, formation of blood clot. Next is fibrinolysis. It is the slow process of dissolving clot. First clot is formed now. After that fibrinolysis occurs. It is a slow process of dissolving clot. Thrombin and tissue plasminogen activator activate plasminogen. It is a product, plasminogen, and plasminogen produces plasmin which digests the fibrin threads, and this process is known as fibrinolysis. Okay. That is the last portion of this chapter, blood grouping. Okay, thank you.